Hey everyone, welcome back to all my listeners. This is episode number 2 of season 9. Today is Wednesday, May 10th, 2023. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, just another reminder to go ahead and start supporting this podcast on Spotify. Because Anchor just became Spotify for podcasters. Now, I'd really love all of your continued support of my content-rich, value-add podcast on Spotify. I've provided a link for you in my show notes to go ahead and start showing your loyal support of my Paint the Medical Picture podcast on Spotify. And I know a lot of you already use Spotify in your everyday lives to enrich them with your music playlists, right? So you already have that app on your cell phones and on your desktops. So go ahead and just find Paint the Medical Picture podcast on Spotify as well. All right, you guys, now you know that I kicked off season 9 by highlighting that the month of May is devoted to mental health awareness, right? But in case you didn't know, the month of May is also devoted to celebrating our Asian American and Pacific Islander heritage communities. So every single Monday of this month on my LinkedIn platform, I'm going to be posting highlights to some really great information, some great resources, and some great places that are celebrating and supporting these people across the country. Now, this week's post of mine on LinkedIn is all about elevating those stories, those contributions, and those experiences of our Asian and our Asian American communities. Now, my LinkedIn post highlights celebrating their many achievements in the workplace, as well as we should be celebrating them in our local communities and as home, of course, as well as in society. Now, there's an abundance of art and cultural artifacts, as well as literature and music that is on display throughout the nation. And of course, our nation's capital is Washington, D.C., and that houses great museums of art and culture that are devoted to our Asian American and Pacific Islander communities. Now, why don't we go ahead and dive into this week's episodes. Now, today's Newsworthy is going to be taking a peek at the April 2023 OIG Work Plan, because remember, the second Wednesday of each and every month of my Paint the Medical podcast series, I look into the OIG Work Plan. And then, of course, in my Trusty Tip section of the episode, I will be diving into, of course, the Modifier 25 because it's in the news again. So I will be stressing my compliance tips and my compliance recommendations for the Modifier 25 once again. And then I'm going to go ahead and round out today's episode in Spark with a remarkable quote on success by Albert Einstein. If you guys have checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and our valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help all of your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts, and definitely start following this podcast on Spotify or wherever you listen to my podcast. I really love all of your continued support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my compliance recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. Today's episode is sponsored by Advanced Coding Services, a leading medical billing and medical coding school in the United States. Whether you're just starting out or a seasoned professional, our training equips you with the tools and support you need to advance your career. Our medical billing and coding school meets your needs worldwide online or in person with one-on-one support throughout your training. We are committed to helping our alumni and credentialed medical community in keeping up their certifications by offering various avenues for acquiring your continuing education units. In addition to our Mastering the Business of Medicine retreats, offered several times throughout the year in different parts of the country, we now offer memberships. You can conveniently earn your CEUs by attending our exclusive members-only webinars. Since our aim is to nurture and grow the careers of individuals who work in the business of medicine, we call our member area the Apple Orchard. Advanced coding services, educate, nurture, inspire, reaching back with a hand up. So let's get into Newsworthy, the month of April's OIG Work Plan updates. It's another short and very sweet update with just 3 work plan items. Now, the first OIG Work Plan for April 2023 is titled the Centers for Disease Control and Prevention's Public Health Crisis Response Cooperative Agreement Program Awards. Now, this report is going to be coming from the Office of Audit Services. The Public Health Crisis Response Cooperative Agreement Program, administered by the Centers for Disease Control and Prevention, that's our CDC, provides awards to state, local, and tribal governments to enhance the nation's ability to rapidly respond to public health emergencies. The program was appropriated more than $2.7 billion through the Coronavirus Preparedness and Response Supplemental Appropriations Act of 2020, as well as the American Rescue Plan Act of 2021, to provide program recipients with the resources to prevent, prepare for, and respond to the COVID-19 pandemic. Now, due to the speed at which the CDC awarded these funds, program recipients may not have established adequate procedures to ensure that funds were appropriately used. The OIG plans to perform a series of audits on selective cooperative agreements with recipients. For each audit, their objective will be to determine whether recipients used the program funds according to federal requirements and applicable award terms and conditions. Now, this final report is expected in fiscal year 2024. The second OIG Work Plan for April 2023 is titled Use of Remote Patient Monitoring Services in Medicare. Now, this report is expected from the Office of Evaluation and Inspections. The use of remote patient monitoring services in Medicare has the potential to exponentially expand. However, there is currently limited research on the use of remote patient monitoring services, such as the types of patients and providers who use these services, as well as the health conditions that are monitored through these services, amongst other details. This review will be based on Medicare fee-for-service claims and Medicare Advantage encounter data for remote patient monitoring services. It will look at the extent to which the use of remote patient monitoring services has changed, the nature of remote patient monitoring services being used by Medicare enrollees, and the characteristics of enrollees using remote patient monitoring services. This review will also determine the extent to which provider billing for remote patient monitoring services may indicate fraud, waste, or abuse. This final report is expected in fiscal year 2024. And the third and final OIG Work Plan update for April 2023 is titled Adverse Events Toolkit, Clinical Guidance for Identifying Harm. Now, this report is expected from the Office of Evaluation and Inspections. The OIG has found that patient harm is common among Medicare patients in a range of inpatient healthcare settings. In support of federal regulations that require hospitals and other healthcare facilities identify harm, such as adverse events, and work to reduce these events, the OIG is developing 2 toolkits. First is the Adverse Events Toolkit, Clinical Guidance for Identifying Harm, and that's going to be geared towards medical reviewers. It's going to include a compendium of guidance that the OIG has developed or adopted for assessing the care associated with 29 specific conditions and injuries. For each condition, the OIG will discuss how they determined whether the condition was the result of harm and whether it could have been prevented. Second, they will also include information about the hospital trigger tool that reviewers used to screen for adverse events and suggestions for finding and recording key information from that hospital trigger tool. This final report is expected in fiscal year 2023. All right, so even though there are only 3 work plan items, right, they each certainly hold a punch, at least I think, in my opinion. Now, the pandemic has had a huge effect on financial ramifications over these last 3 years. It's no doubt that now is the time to start looking at if those monies distributed were appropriately utilized. And of course, our technology in healthcare is booming. So the OIG needs to have assurances that remote patient monitoring is being used as indicated and on what types of their enrollees: heart condition patients or diabetics or those with neurological deficits, etc. Those are the types of patients that they will be looking at. And for sure, this review is going to look at if there's been any fraud and abuse or even waste with these newer remote patient monitoring services. And lastly, those toolkits, right? I love to develop toolkits for my own providers and myself as well. So I'm definitely looking forward to seeing what the OIG has in store to help reduce adverse events for this population of patients. So I think that these reports with findings are always most interesting and informative, and I definitely look forward to analyzing them in the years ahead. It's also important for my listeners to pay attention to these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. And now it's time for my best practice tips in Trusty Tip. So in today's compliance tip, I wanted to reinforce how to appropriately append Modifier 25. That's right, that big bad boy Modifier 25 is once again in the hot seat. Because if you haven't heard, there's a very, very controversial Cigna prepayment policy that is about to be effective on May 23rd, despite the AMA, as well as many medical societies and physicians' organizations throughout the country delivering their 2 cents to the Cigna pending policy. So let's get into it. Let's get into how can we appropriately append Modifier 25 and still receive reimbursement. So I've broken this down in today's Trusty Tip into 4 sections of how you can go ahead and compliantly use the Modifier 25, the do's and the do nots, right? So number 1, remember that Modifier 25 should only be appended to our E&M service codes, right? Those evaluation and management service codes. And as you peruse through your CPT coding manual, remember there are instructions for how to use Modifier 25 all over the CPT coding manual, like specifically, for example, in the hemodialysis section of the code book, as well as in the allergy and clinical immunology section of the code book, and also in the drug infusions section of the code book. All right, so let's move on to number 2. So remember, there are those usual preoperative and postoperative services, right? So our physicians and our other qualified healthcare professionals, those QHPs, should be aware of what services are included in the surgical package, because those would not be reported separately, right? Because those are the kinds that are already bundled into that surgery service. Now remember that in our CPT coding manual, it's listed. It's right there in black and white that there's a surgical package definition in the surgery guidelines section of the CPT code set, right? So some of those specific services that are bundled into the surgical CPT code are listed right there for you in that section of the CPT code set. So just like those E&M services that are subsequent to the decision for surgery on the day before and or the day of the surgery, remember that those include the patient history and the physical examination, as well as the immediate postoperative care including those dictations of your operative notes. It also includes talking with the family as well as other physicians or other QHPs. It also includes the writing up of your orders. It also includes the evaluation of the patient in the post-anesthesia recovery area, as well as your typical post-op follow-up care, right? So those things are already included. So then number 3, you can use it for more than one E&M on the same date of service, right? But how do you do that? How can you use that Modifier 25 if there's more than one E&M on the same date of service? So in these types of cases, the appropriate E&M code would be appended with the Modifier 25, right? So there are great sections in our CPT codebook that include the preventive medicine section, as well as the newborn care section, right? So CPT definitely spells out all of the instructions for how to use the Modifier 25 properly within these sections. So go ahead and review those details so you understand how to appropriately append the Modifier 25. So the classic example to use, right, is in the case of preventative medicine services, right? If there's an abnormality that's encountered or there's a pre-existing problem that's addressed in the process of performing a preventive medicine E&M service, and if the problem or abnormality is significant enough to require additional workup to perform the key components of a problem-oriented E&M service, then you should definitely go ahead and appropriately use that office or other outpatient visit E&M code, right? That should be reported, and again, with the Modifier 25 in that case, right? If it was separate, if there was a separate problem that was worked up. And then that leads me to my 4th, right? Is that E&M service really significant and separate to warrant that Modifier 25? So a significant and separately identifiable E&M service is defined or substantiated by documentation, right? It's that documentation that will clearly spell it out and that will satisfy the relevant criteria for the respective E&M service to be reported. And I always recommend to go ahead and use that different diagnosis code that's supported in documentation, right? And it's supported through the medically appropriate physical examination, as well as the medically appropriate history, right? And go ahead and link that diagnosis to that significant and separately identifiable E&M code on the claim. That's definitely another way to demonstrate the appropriateness of the Modifier 25. Now, I do know that that NCCI manual of ours, right, our National Correct Coding Initiative manual, says otherwise, right? It says that a different diagnosis is not necessary. But again, in my experience, it's often much easier to demonstrate something separate and significant was performed for an additional problem-oriented evaluation and management service on the same day. So these are just some of the ways that you too can boost your documentation before you send it to Cigna alongside your claims with Modifier 25. Now, these are just a few ways to have no stress, right? If this particular Cigna policy actually takes effect in a few weeks. Now, I know it's still an overly burdensome process for our providers to submit medical records with each and every Modifier 25 claim. And the fact that Cigna has publicly said that it will only review 10% of that documentation is in itself, I mean, wow, right? It's just wow. All of that paperwork that our providers are submitting is only going to be looked at in 10% of cases. 10%. That's just a big wow factor there, right? But I know you've got this if you just apply the appropriate use of Modifier 25 proactively. I know you've got this. A better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, I focus Season 9 Spark on success. I want this 9th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone who inspires the need for success in all we strive to do. So, in this week's inspiring quote in Spark is from Albert Einstein. Try not to become a man of success. Rather, become a man of value. Absolutely true, right? I think this is an amazing quote that reminds us of our value. Our success delivers our value not only to others, but reminds us time and time again of our own value. I think this quote inspires us to keep increasing our value through our work. We work to give to others, to give to our peers, to give to our community. I think this quote reminds us that our success is valuable to so many. This quote inspires us to change our mindset on the traditional way of thinking. We need to embrace both our success and our value simultaneously. I'm happy Albert Einstein's spark still shines on in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. So in my final note today, I wanted to send some positivity and hope down to my very good friends in the Dallas, Texas suburbs, the Allen, Texas area, where the 200th mass shooting happened over this past weekend. It was another senseless and very stupid act of violence unleashed on the innocent people. The tragedies and the human loss continue to increase year after year after year. Now, all we can do is play our own part in helping where and when we can. Now, you do know, right? We'd have some cause to celebrate. On to something a little bit happier, right? Tomorrow is the day to celebrate, right? It's the day that the National PHE is finally over, and hopefully it will one day be a holiday. I know for me, it's going to be a holiday for sure. And also don't forget, it's Mother's Day this Sunday. So go ahead and show love to your mama and let her know that you care. Show some love to all of the women in your lives who are mothers to someone somewhere. They make a tremendous impact. Now, I wish you guys all an amazing week ahead. Thank you so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.